Hi, Carolyn here in Bangkok, Thailand. I just wanted to check in with all of you here. It's exactly 2 weeks since I've had my facial feminization surgery here in Thailand. As you can probably tell by the way my mouth is moving when I talk, my lower lip is still kind of numb, and certainly my face is still pretty swollen. And that's normal, you know. These things will continue to kind of evolve over the coming weeks and months, and that's fine. Also, you may notice this line up here, right below my hairline. There were stitches along there. They were actually just removed this morning. So the recovery is going fine. It's going great. So I just wanted to talk briefly about what the experience has actually been like for me, I guess kind of emotionally and spiritually, if you can say that. I have to say that it's been, for me, extraordinarily powerful. And I want to be very clear in saying that I absolutely don't think that facial feminization surgery is something that makes me more of a woman than I was before I had it. It absolutely does not. I was a woman before. I'm a woman now. That hasn't changed in any way because of this. What it is doing for me is it's giving me the feeling like I am able to see the woman that I've always been more clearly than I've been able to in the past. For me, you know, my face was, I always perceived it anyway as being pretty dominated by what we might call male cues, or things that at least led me, when I looked at it, things in the brow and forehead and things in the jawline and chin, things that led me when I looked at it to feel like, oh, that's a male face. And this is something that I think we all do on just an immediate subconscious level. We see faces and we kind of categorize them, and because I internally identify as a woman, having that experience when looking at my own face was extremely jarring and painful. It was a really, really major trigger of feelings of dysphoria for me. And now that I'm able to look at my face and see the things about my face that I've always really identified with, you know, like my eyes, and have them not be so overshadowed by these kinds of male cues, it's extremely powerful. It's sort of deeply validating, like to look at my face now and to be able to see myself, you know, come through so much more clearly than I was able to before, and it just feels much more right in a way, because I can look at myself in the mirror now, and I don't have that immediate kind of that trigger of dysphoria that leads me to feel this disconnect between who I am and what I'm seeing. And you know, I did this for myself. You know, I didn't do this because people give me a hard time on the internet. You know, I could care less. I didn't do it for anyone else. You know, I did this for me, and I really think that it's a hugely important step in my transition. I really feel like this is something that, maybe more than any other single step is going to be very effective in terms of dispelling feelings of dysphoria and making me feel comfortable in my own skin and comfortable with the person that I know I am. It's difficult to even articulate just how powerful, the whole experience is. And I don't think it's an experience that most people can really understand. But I hope that I'm making some sense in trying to express what this is like for me. I also just briefly want to say a few words about privilege. I saved up money for a long, long time to be able to do this. I'm extremely fortunate that I was in a position where I was even able to do that. And some people may think of something like facial feminization surgery as cosmetic, but really it has it can be such a powerful tool for reducing or eliminating the really truly painful feelings of gender dysphoria that can overshadow every moment of the waking lives of transgender women. And so I think that it's absolutely unacceptable that surgeries like this are sort of available only to those who can afford them. And I think it's absolutely vital that as more and more sort of transgender-related surgeries and other services are kind of being covered by insurance companies and so on and so forth, that surgeries like this, like facial feminization surgery, are seen as not just cosmetic, things, but as things that need to be available to any transgender individuals who feel like they might benefit from them. So, in any case, I guess that's about all I have to say for now. So I'm going to sign off. I'll check in probably periodically in the coming weeks and months. Give you all an idea of how things go as my transition continues. Thank you so much for watching, and I'll talk to you soon. Take care. Bye.